specialist plastic surgeon here at the Sydney Adventist Hospital, and I also work at Royal Prince Alfred and Prince of Wales. Facelift and neck lift surgery is largely aimed at people who, obviously over the years have had a little bit of aging in terms of their facial appearance, and they get a little bit of skin laxity in certain areas. So by that I mean, they'll have some loose skin that's developed as the face and everything slowly descends. So the common places where you'll see that are, around the folds near the mouth. So you get a little bit more of a hang of the skin. You see a little bit along their jawline, and it's interesting how youth defining the jawline is. So someone who's got a very distinct and very clear jawline often looks a lot younger, and someone who just doesn't have quite that clear line will look a little bit older. So people who have a little bit of loose skin down here called the jowl often don't like that, and because it makes them look a little bit older. Similarly, they'll have some loose skin maybe in their neck and often in the center of their neck, and they can get some banding of their neck, by which I mean when they look down or they tense their lower lip, they can get bands of muscle that shows up in their neck, and people don't like that, again, because they're quite aware of, in social settings, people looking at that area, or at least they feel that they're being looked at. So I think those are sort of the people who, and I guess it's the person who really feels that that's impacting on their personal life. So it'd be someone, the people I get to see are people usually, they don't have to be, very elderly. They might be in their 50s or 60s. They're still very actively working. And sometimes they're just in an office setting. There might be something that they're always in the public eye. They might be doing marketing or sales, or they're often going out to see clients and they're driving around. And so they often feel like they're the forefront of their business or whatever institution they work for. And for them, interviewing people and so on, they're quite conscious of how they look. And I guess it always underpins like their underlying confidence and how they feel about themselves. Then there's also people who, might be in any age group, but they just feel aware of that because of their personal relationships, or they might be a single person, or, it's a confidence thing, and, they seek improvement for that reason. So I think facelift surgery, in terms of what's involved, it's certainly come leaps and bounds, and we're very good at now hiding the scars of facelift surgery. And I think that's what people are aware of. And I think for me, it's not just about hiding the scars, but about how someone looks. It needs to look fairly simple, it needs to look natural. And it's not about converting someone who looks like in their 50s back to when they were 20. You need to make them look something realistic, because I think there's a fine balance between looking someone like they've been operated on and someone who just looks naturally beautiful. So what I say to everyone is, I think the goal of facelift surgery is for people to notice, but they shouldn't notice that you've had an operation. So, so what I talk to them about is just something that's appropriate to their age. So we usually do a scar that's around the ear, so in front of the ear, and then it goes around the lobe and back to the hairline. And so the only time that scar is ever going to show is when someone wears their hair up, where the scar behind the ear may be noticeable. It's also the scar where all of the tension of a facelift is held in. So the scar, can be a little bit broader than anywhere else. So if people are okay with wearing their hair down or just seeing how their scar goes, then it's pretty good. In terms of what's involved in an operation, it's a general anaesthetic. The operation takes about 3 to 4 hours. While you're asleep, we put local anaesthetic everywhere along the face, usually along the face and the neck. We usually start off, if you need to, with some liposuction of the neck. Like I said, the jawline is pretty critical to how youthful you look. And then under the skin, we lift the skin and basically tighten the skin, but the skin relaxes over time very quickly. So, with any operation, whether it's on the breast or the tummy or wherever, the concepts are the same, where we do repairs under the skin that will hold the tension and the shape over time. So there's a layer under the skin which combines all the muscles of the face. It's called the SMAS, or SMAS. And if people who look up this operation, will see different surgeons do different things to that layer. But what we do is tighten that layer by way of suturing or excising some of that layer, and then just draping the skin. So the skin will relax a little bit, but you don't want the result to relax quickly. So in terms of, once they recover from the surgery, what I expect people is they look pretty tight at the start, but in the first, few weeks, they'll relax about 10 to 15%. And again, I think that's actually not detrimental. I think that makes them look a bit natural. I warn people that they look pretty bruised and swollen. They can be pretty impressively bruised and swollen in the first week, but by the time they see me at the end of the 1 week, they're actually not too bad, and after 2 weeks, they're pretty good. So it's 1 to 2 weeks in terms of downtime, But after that, they're usually at work, they're usually doing social things, they're pretty socially acceptable. The recovery is not, it's actually quite good.